Medicare's confusing? Stick around. Chris makes it make sense. Even I get it now.
Hi, I'm Christopher Westfall, the Senior Savings Network. Lots to cover today. I'm going to show you exactly what this new law does to your money and to your healthcare, and why some of these permanent changes aren't really permanent at all. And in the end of this video, I'm going to give you a secret word that not only gets you priority responses to your comments and feedback here, but also helps me know what topics to cover for future videos. So stick around. If you want to skip ahead to different topics here, you can just see the topics in the chapters right there and skip right ahead. Also in the description is a list of them there. Let's start with the tax break. So the senior bonus deduction, here's some good news. If you're like most of my viewers, you're 65 or over, you've just qualified for an immediate, for this year, brand new tax break called the senior bonus deduction. So for the 2025 tax year already, you're getting an extra $6,000 off of your taxable income just for being 65 or over. If you're married, that's $12,000, and this is automatic. You don't have to do anything. You don't even have to be drawing Social Security to qualify. Just be 65 or over by the end of the year. Now, you may recall that there was a promise that there would be no taxes on Social Security anymore.
Ready? Here's for the seniors. Do we have any seniors in the audience? Raise your hand. You ready? No tax on Social Security benefits. No tax on Social Security benefits. And you know why you deserve it? Because you lived like hell with the highest inflation probably in the history of our country, and you couldn't make ends meet. Now you're not going to have to pay tax on your Social Security benefit.
Well, that did not happen, but they say, Social Security Administration, that this will eliminate taxes for 90% of seniors. And there's better news. The current tax brackets are staying the same. So whereas those that were in the 12% tax bracket were going to go to 15, those that were paying 22%, it was going to go to 25, and those that were the 24% tax bracket, that was set to automatically go up to 28. Those scheduled increases are now gone. But here's the catch that I mentioned. This new tax deduction, just for seniors, does not shield you from the IRMAA calculation. The IRMAA stands for the Income-Related Monthly Adjustment Amount. It's the amount of extra premiums that high-income seniors have to pay on top of their regular Medicare costs for Part B and Part D if you have it. Let me explain what this means for your wallet. If you are a high-income senior, for 2026, these higher premiums kick in based on your 2024, 2 years ago, income. If back then it exceeded $103,000 for the year, if you're single, or $206,000 if you're married filing jointly, then you have to pay extra premiums. Now, you might be wondering, what are the rates going to be for 2026? Well, we don't know yet because they don't come out until November. The income thresholds are expected to increase only by 1% due to lower inflation rates, which is good. Here's the critical part. The Part B surcharge will only go up by an expected 1%, while the Part D surcharges are expected to jump by more than 6%. Now remember, IRMAA, unfortunately, this penalty if you make too much, is a cliff penalty, meaning your 2024 income, if it exceeds that threshold by even $1, then you pay the full higher premium. And it's based on your modified adjusted gross income from the 2 years ago. So yes, you get a tax break, but Medicare might still penalize you based on your full income. So many retirees were getting right up to the deadline of the taxes going up in the brackets, and they were trying to convert their traditional IRAs, which would be taxable for life, and convert that to a Roth IRA, which is not taxable based on what you take out. And they were trying to do this in a quicker schedule because they thought that the good tax rates were going away. Well, now you have more time. You can slow down those Roth conversions and spread them out over more years, which means you can keep more of your income lower in any given year, reducing then your exposure to the high IRMAA penalties. So if you're thinking about doing a Roth conversion, or you put it off and you're wondering how to manage your income so that it can avoid IRMAA penalties, there is a strategy that using annuities, most financial advisors just don't talk about. It's a specific type of annuity that doesn't count towards IRMAA income. But most advisors, again, just overlook it. It could help you smooth out your conversion income to potentially save thousands in Medicare premiums. I'm going to be covering this advanced strategy in a coming video, so make sure you're subscribed and you stick around. And yes, our office can help you with that. The whole process there is very simple, but it has to do with your IRA or your 401k so that your money remains safe and available to you for the rest of your life. Chapter 2, the permanent lie. You've probably seen other YouTube videos calling these tax changes permanent. Let me tell you why that's misleading. The bill extends the current tax brackets beyond 2025, but permanent only means they are not scheduled to end right now. Congress can still change them anytime they want. So these rates may not last, or they may. It depends on future votes and the political winds of our time. Don't plan your retirement around these things being permanent. There's no such thing. And speaking of protecting your finances, if you plan on doing any traveling in the next year, a lot of my senior clients do, here's something important that you need to know. If you're a senior on Medicare and you're planning to travel outside the US, here's something most people don't realize. Medicare does not cover you outside the United States. Not for emergencies, not for hospital stays, not even for doctor visits. Some Medicare supplement plans do offer limited coverage outside the United States, but listen, it's only for emergencies, only lasts for 60 days, has a lifetime benefit of only $50,000, which could go fast in a modern country. And it only pays 80% of the medically necessary emergency care, leaving you to pay the other 20%. Most Medicare Advantage plans, they don't cover you internationally at all unless you're in a dire emergency and you have to pay out of pocket first. Then you have to fight for reimbursement with them later, and we all know how those claims can go. Here's the good news. There's a better way to stay protected. We have a trusted provider that offers simple, affordable global travel, and they pay the claims right away for our viewers. It covers emergency care, medical evacuation to get back to the United States, 24/7 telemedicine so you can talk to somebody, pre-existing conditions, and more are covered. And it's so easy. Just to get a quote, you go to seniorsavingsnetwork.org/travel. So write that down somewhere before you're going to go on the next trip. You can literally be covered the same day. And again, applying for it only takes like 2 minutes. seniorsavingsnetwork.org/travel to see that awesome program. So if you're stepping on a plane or a cruise ship, make sure you're protected beyond our borders. Now back to those Medicare changes that could affect your coverage. Chapter 3. Medicaid cuts and the rural hospital crisis. This next part might shock you, especially if you live in a smaller town or far from the big cities, but this bill, now law, reduces federal Medicaid funding from the government from 90%, the states pay the rest, to 80% for those states that have expanded their Medicaid. So while this saves Washington money, it's going to create, they say, a rural crisis in America. States will see more than $1.2 trillion in Medicaid cut over the next decade. It's $120 billion cut per year, with $665 million of that going right to hospitals directly. The expansion states will be hit the hardest, but California is expected to lose $119 billion. Texas, which did not do Medicaid expansion, will still see $21 billion in cuts, they say, and more than 300 rural hospitals could close almost immediately in 2026. Hundreds more at risk. Dr. Holland Hayie, who runs a rural healthcare center in Missouri, he calls this the most consequential change to U.S. healthcare in more than a decade. And he's on the front line with people that are on mostly Medicaid. I have a link to his full article in the video's description below so you can read his complete analysis of this. His clinic that he works in serves more than 20,000 patients. Get this, 98% of them are at or below the 200% of the poverty level. So he's already seeing the impact of the new Medicaid work requirements that are coming now. People have to verify to be on Medicaid. That's the low-income health insurance. This is not Medicare, but watch, it affects you. People will have to verify that they're working 80 hours per month or they're going to school, or they're doing job training. Problem is that when you're out in the rural areas, and this is what Dr. Hayie said, a lot of times these folks out there, especially the low-income folks, have poor access to the internet, unreliable transportation to get to work, and sometimes they're taking care of other people in their family. So these people now have to recertify for Medicaid every 6 months by filling out paperwork. So it's said that a lot of people will do it wrong, or will forget to do it, or just not do it at all, and they'll lose their Medicaid benefits. If you're on Medicaid and you're a senior citizen and you're also on Medicare, understand that these work requirements, they don't apply to you. It's just for the people that are under 65. So the real concern is that if Medicare coverage erodes, and it funds many hospitals, most of them, then the emergency room is going to become the safety net for the chronically ill people, overloading hospitals and increasing the uncompensated care that hospitals have to give away, especially if they're publicly funded. So what does that do? It raises the costs across the system for everybody else, those with employer insurance, those with Medicare. And if the rates from the hospitals charged to Medicare are going up in the supplements, then the supplements are going to go up even faster. Many rural hospitals only get by with 3% margin, and nearly half of them are running at a loss. Now, this bill does include $50 billion in rural relief over the next 5 years. But when you divide that by more than 2,000 rural hospitals, it's nowhere near enough to make up for the funding losses. So let me show you a real example from Virginia, where a rural clinic is facing exactly what Dr. Hayie has described.
Small change in Medicaid could have a big impact on our bottom line.
The cuts mean 300,000 Virginians could lose their health insurance, leading to less patients at rural hospitals or clinics like the Tri-Area Community Health Center in Ferrum.
How many people might not qualify for Medicaid moving forward? What do we need to do to try and make up for that lost revenue?
The center's CEO, James Worth, says these cuts mean almost $500,000 in lost revenue for the Ferrum Clinic alone, leaving officials there with some tough decisions to make.
Our staff is at risk. Our service lines are at risk. Even a site might be at risk.
The consequences of this could be deadly.
If we hadn't been here in those instances, then there could have been a death. In the future, if we aren't here, then again, that same thing might happen.
Virginia Hospitals and Healthcare Association's Julian Walker says the impacts of these potential closures will affect more than just the patients themselves.
There is the potential for an economic ripple effect, not just to the direct hospital operation, to its stability and survival, but to the employment it provides, to the financial support it provides to the community as an employer, as an organization that has business relationships with other entities.
The bill did leave $50 billion in funding for rural hospitals, but Walker says that's not guaranteed to come to Southwest Virginia.
All that money went to rural hospitals. It still would not come close to closing the gap of the Medicaid funding losses that are contemplated in this package.
So as you just saw, that's the reality. $500,000 in lost revenue just for one clinic. And that's pretty significant. So that means staff, services, the entire facility are at risk. And notice what the Virginia Hospital Association said about this. If all $50 billion in rural relief, part of this bill, were allocated to the rural hospitals, it still doesn't come close to closing the gap, they said. However, if you're planning on long-term care in the future, and you should have that as part of your financial retirement package, some kind of plan for long-term care, pay attention to this part. Roughly 7 in 10 seniors will at some point need long-term care treatment. Nursing homes rely heavily on Medicaid for their funding. So you're not allowed to use Medicaid for nursing home care, for long-term care, until you've spent down all of your assets. But when people do, and sometimes it's $200,000 or $300,000 a year for long-term care, they end up on Medicaid.
Jason Barrett visits his 94-year-old grandmother, Ruth Rainey, at the Martinsburg Healthcare Center in West Virginia as often as he can. What does she mean to you?
Well, she means everything.
Medicaid will soon be covering the cost of Rainey's care, putting her among the 77% of West Virginia nursing home residents who rely on it. Nationwide, that number is 63%. But that funding could be cut by roughly $1 trillion by the massive spending bill now in Congress. The concern is those cuts could lead to reduced staffing and tightened eligibility requirements in long-term care facilities nationwide. The House version of the bill would require states to fill the funding gaps, and some may come up short. If there are changes or cuts to Medicaid, are you concerned about your ability to operate? I would be. Nancy Mason runs the nursing home where Ruth Rainey lives.
It helps to meet our operational expenses, everything from pharmaceuticals to food to utilities to recruitment of staff, wages.
Essentially, everything that helps keep this place running and serving the residents here relies on that funding.
A large portion of it, yes.
We have to get to a place where we're balancing our budget again. I don't think we do that on the backs of nursing home residents.
Barrett isn't just a concerned grandson. He's also a Republican West Virginia state senator. If the federal government changes the way that they contribute to the Medicaid program, essentially, do you think West Virginia can pick up the gaps?
Pick up those gaps entirely? No, I don't believe so. A complete backfill of cuts to Medicaid would be very crippling to our state budget.
So as that nursing home administrator explained, Medicaid pays for everything: pharmaceuticals, food, utilities, staff, wages, everything that keeps those facilities alive. What does Medicare cover for long-term care? Pretty much nothing. This is why Medicaid is so important. So Medicare itself, and that's what you paid into your whole life, you got ready for Medicare, it does not cover custodial care. And that means help with bathing, dressing, toileting, eating. And it does not cover assisted living facility costs. It also does not cover long-term nursing care beyond 100 days. It doesn't cover memory care for Alzheimer's patients, unless skilled medical services are required under a short-term or a hospice program. It also does not cover adult daycare. Reduced funding support for Medicaid could result in lower staffing and quality care for seniors who require that assistance. So the bill does have some funding for rural hospitals, but the administrators, again, are warning that it's nowhere near enough to offset these damages. Senator Lisa Murkowski, she's the one that insisted before the Senate could get her vote. And by the way, the House bill is exactly what ended up passing. Wasn't changed except for very tiny provisions, and this is one of them. Senator Murkowski insisted on this money for rural hospitals be added to the final bill. Otherwise, she wouldn't have been there for it. But it's only $10 billion per year for 2026 through 2030. And that's just not enough to fill what's going on with the rural hospitals and with nursing homes. Chapter 5, bad news for pre-Medicare couples. So if you're helping a spouse or a family member and they're under the age of 65, or you're an early retiree waiting to qualify for Medicare, then this change could affect your wallet hard. Initially enacted with the American Rescue Plan, remember that? And then extended by the Inflation Reduction Act, enhanced credits to help pay for the Affordable Care Act insurance for those under 65 were already set to expire 2025, December 31st. Those subsidies helping with premium payments currently save people $705 a year on average. And that means that it reduces their premiums and their deductibles by an average of 44% of what they would have paid otherwise. But again, those are going away. There's a double hit coming for those people under 65. First, insurers are already filing to raise their premiums an average of 15% more than expected. Secondly, when the enhanced subsidies expire, the amount that you pay out of pocket are expected to increase by 75%. Let me give you an example. Someone making $25,000 a year could see their annual premium payments jump from $160 for the whole year. Some people are not even paying anything for the Affordable Care Act. to $1,077. That's a 573% increase for a low-income person paying for the Affordable Care Act. The Congressional Budget Office, like them or leave them, they estimated that 8.2 million people who currently have Affordable Care Act insurance will go uninsured. But again, this is not because of the big, beautiful bill. These expiring credits were coming anyway. And a lot of people expected that they might be added to the bill to subsidize people even further, but no. And there's one thing hitting ACA plans right now. There's a big focus in this administration on stopping fraud, waste, and abuse. Well, CMS has just finally enrolled this program now where they're going after people that are defrauding the ACA. It's going to affect coverage for a lot of people. They estimate 1.8 million people could lose coverage from new verification requirements. So the good news is, ultimately, they say this is going to save premiums from the Affordable Care Act, but right now, it means that you're going to have more income verification required if you're getting any kind of subsidy. And you may face unexpected premium charges. Those are going to start January of 2026. So here's what you need to know. The cost sharing reductions, by the way, on those plans under 65 only apply if you get a silver plan in the marketplace, not the bronze, not the gold. It has to be the silver plan. And you lose that benefit if you're getting any kind of subsidy, even if you qualify based on income. So here's an example. Let's say Maria earns $24,000 a year and she qualifies for a cost sharing reduction. If she picks a silver plan, then her deductible would be $500 before she starts getting her health care covered. $500 is great. However, if she selects the bronze plan, which has even lower premium, she thinks she's saving money. No, her deductible could go to $6,000 immediately. Same income, but the wrong plan choice. Big financial mistake, which means the coverage gaps and financial strain right before Medicare kicks in. If she's 64, that's the most expensive time to get on the Affordable Care Act plan. You have to get the silver plan. But wait, there's even something more shocking that could affect seniors on Medicare. For the first time in history, original Medicare will start requiring prior authorization. What? I've talked about that for years. Matter of fact, Dr. Oz had that big press conference recently, which we covered, where he obtained promises from Medicare Advantage companies that they will rein in their historically punitive prior authorization process. Takes too long, denies too much care. And these insurance companies, all the big ones, promised him they're going to fix it. So what did he do? He went and started prior authorization for original Medicare. Now, it's only going to be in 6 states, and it's a trial program to run for just a few years, but it could impact some people. And we'll get into that in great detail here shortly. Plus, I'm going to show you why Medicare Advantage PPO plans are disappearing. First, they stopped paying agents commission if they enrolled people on Medicare Advantage PPO plans. And now, for next year, they're already disappearing out of the landscape. That actually might be a good thing for you because there's a very costly surprise with PPO plans that many seniors just don't know. And I'm going to cover that in part 2 of this video series, going over the big, beautiful bill and how it affects Medicare and Medicaid. But before you watch part 2, put the word ally in the comment section below if this video helped you understand anything at all. I also have some documentation, lots of links in the description that might help you. But if you put the word ally, A-L-L-Y, in the comment below, that lets me know that you were the one that watched this video to the end, and I will respond to your comment first. If you need help navigating these changes or more, like all the things coming at you, and you want to review your Medicare options, give us a call. It's toll free, and you can call 24 hours a day to leave us a message to 800-729-9590. It's shown right here. Or visit seniorsavingsnetwork.org, where you can book an appointment 24 hours a day. Make sure to subscribe to these updates. There are a lot of them coming, and I did not rush to the internet to put out what the people said were in the bill because some things were in there that didn't make it. So you have to ring the notification bell when you subscribe to get notified when these things are coming out. And in part 2, I'll show you exactly how to navigate these changes and protect your coverage.
Look, I'm 8 feet tall and covered in hair, but even I ain't brave enough to face Medicare without Chris.
Thanks for watching. God bless you. Stick around. We're going to have part 2 out here very